Hospital of Death. The story is about a young journalist named Sarah who wants to write a report about Bellevue Hospital, one of the oldest and most famous psychiatric hospitals in New York. The hospital is now in a state of decay due to lack of budget and supervision. Sarah wants to talk to some of the patients and nurses and see what conditions they have and what problems they face. Sarah arrives at the hospital with her camera and voice recorder and talks to the hospital director. The director is an old and thin man named Dr. Rizzi, who looks tired and worried. Dr. Rizzi gives Sarah permission to talk to some of the patients and nurses, but warns her to stay away from the northeast wing of the hospital. That's where the most dangerous and strange patients are, and only experienced and professional nurses are allowed to enter there. Sarah asks Dr. Rizzi curiously why she shouldn't see that wing. Dr. Rizzi says in a serious tone that it's a dangerous and cursed place, that anyone who gets close to it will suffer from guilt. Sarah thinks that maybe Dr. Rizzi himself is a bit mentally ill, but she respectfully listens to him and promises to stay away from that wing. Sarah starts to explore the other parts of the hospital. It's a gloomy and dark place. Seeing the faces of the suffering and moaning patients, the sound of screams and chains, the smell of blood and infection, all makes Sarah feel uncomfortable. Sarah talks to some of the nurses and realizes that they are also under a lot of stress and pressure. They complain about the lack of staff, equipment, medicine, and security. They say that sometimes they have to deal with violent and aggressive patients who attack them or try to escape. They also say that they have seen strange things happening in the hospital, such as doors opening and closing by themselves, lights flickering on and off, voices whispering in their ears, shadows moving in the corners, etc. Sarah is intrigued by these stories and decides to investigate more. She asks one of the nurses, a young woman named Miriam, if she can show her around the hospital. Miriam agrees, but warns her not to go near the northeast wing. Sarah nods, but secretly plans to sneak into that wing when Miriam is not looking. Miriam takes Sarah to different rooms and wards, where she sees different kinds of patients. Some are depressed, some are paranoid, some are schizophrenic, some are bipolar, some are psychotic, etc. Sarah interviews some of them and records their stories. Some of them talk about their past traumas, some of them talk about their delusions, some of them talk about their hopes and dreams, some of them talk nonsense. Sarah feels sorry for them and wonders how they ended up in this place. She also wonders what kind of patients are in the northeast wing that everyone is afraid of. She decides to find out for herself. She waits for an opportunity when Miriam is busy with another patient and then slips away from her sight. She follows the signs that lead her to the northeast wing. She sees a metal door with a sign that says authorized personnel only. She ignores it and tries to open the door. It's locked. She looks around and sees a key hanging on a hook next to the door. She grabs it and inserts it into the lock. She turns it and hears a click. She opens the door and enters. She wishes she hadn't. She sees a long corridor with dim lights and dirty walls. She hears a low humming sound coming from somewhere. She smells something rotten and foul. She walks along the corridor and sees several cells on both sides. Each cell has a small window with bars on it. She looks through the windows and sees what's inside. She sees zombies. Not the kind of zombies that you see in movies or games. These zombies are not dead or undead. They are alive, but barely. They are human beings who have been experimented on by someone or something. They have been injected with a virus or a drug that has turned them into mindless creatures. They have lost their hair, their skin, their eyes, their teeth, their nails. They have become pale, thin, deformed, mutilated. They have wounds all over their bodies that are infected and bleeding. They have wires attached to their heads that connect them to machines that monitor their brain activity. They have tubes inserted into their mouths that feed them with liquids that keep them alive. They have no clothes on them except for diapers that are soaked with urine and feces. They have no names, no identities, no memories, no emotions, no thoughts. They have nothing left of their humanity. They are just zombies. Sarah is horrified by what she sees. She feels sick and nauseous. She wants to scream and run away, but she can't. She is paralyzed by fear and curiosity. She wants to know who did this to them and why. She wants to know if they can be saved or not. She wants to know if they are aware of their condition or not. She wants to know if they feel any pain or not. She wants to know if they are still human or not. She wants to know too much. She walks further down the corridor and sees a door at the end. It has a sign that says laboratory. She opens the door and enters. She wishes she hadn't.